Good afternoon. I'm Stuart Craig, an elected carer rep on Focus. Although a relative newcomer to involvement with the NHS, I was sceptical about how effective Focus could be. However, the Trust Board and Executive have been very supportive and responded positively to every issue that has been raised, although not necessarily accepting that action could be taken on every issue. To me, this is the great success of Focus. Whilst NHS bureaucracy has prevented action being taken as quickly as we should have liked, at least we are making significant progress. Thank you.
Hello, my name is Sally Brodie, also a Focus rep. I was also delighted to be the service user sponsor for the nomination for Focus for the Best of Health Awards. And as you heard from Lucy earlier, we were delighted to win it as well. I have put my summary statement from that for the application in your packs, along with the other information about Focus, and hopefully you'll read it. In it, I referred to what I regard to be three of the main benefits of Focus: organisational growth, learning growth, and individual growth. I could speak probably for an hour on each of those, but they have been huge benefits and brought about because Focus is a type of involvement, or it's an involvement model. I hate using that word, but it goes way beyond involving people who use services and carers in individual care. Although I should say that one of the great achievements of Focus has been developing standards for involving people. We have 7 standards adopted by the board, and one of those does focus on involvement in individual care. But Focus, as a governance committee, goes way beyond that. I could list, and I think Lucy's going to mention briefly afterwards, a few of the notable achievements of Focus. But those arguably are just the tip of the iceberg. All sorts of spin-offs across the board. For instance, every month we seem to get more and more staff attending our area group meetings, and they come not because of a 3-line whip, but because they say that it really helps them to do their jobs better. And other things I should mention, that there's a number of us Focus reps who are on the Trust's new Council of Governors. And I think we've seen today how much personal growth some individuals who've taken part in this venture have gained. So, before I hand over, and I've probably used my time up already, why does Focus work? What has made it work? A whole host of things, but I'll single out the following. Formalised arrangements, the commitment of all involved, the willingness of directors and other staff to listen and be challenged, and last but not least, the superb facilitation of Lucy, who really has hold the whole thing together. However sound a model is, someone has to make it happen, and Lucy's done just that. Thank you.
Hi, I'm Russell West. I'm a rep for the South West Area Group of Focus. I also work for the NHS as a photojournalist and help publish our Trust newspaper. And it's through my work with the Trust, and of course more importantly with Focus, that I've come to understand that what people who use our services want is not just to have a voice, but to be actively listened to be consulted with, so that we can help bring about the changes that are needed. And that's exactly what has happened through Focus. Our Trust vision and values have shown we, as users of the services and those delivering them, have shared hopes and dreams. The vision and values were created by people who use our services, their families and their carers, along with Trust staff. Many of them also help create Focus. And we hope that the work we do with Surrey and Borders Partnership NHS Foundation Trust inspires others in the NHS to follow our example of best practice. Be part of the change you want to see. Become involved in making things even better than they already are, not just for yourself, but better for everyone who uses the services of, and for those who work for the NHS. And finally, a huge thank you to Lisa.
No, not you.
She's really made Focus what it is. Thank you.
Well, I'll just close by saying what a privilege it's been to be involved with Focus so far and to see at first hand what can be achieved when people really do set their minds to working together. The conversations have not always been easy, but I think everybody has matured in the way we've discussed things around the table. There are we haven't actually mentioned any of the specific work, but for example, the standards for involvement, which were mentioned, but it also, as a result of conversations, we've initiated a code of conduct for visiting people in the community. We brought up a range of concerns around soundproofing and confidentiality, which are now all part of the Trust's capital plan. Specific issues around PRN medication, and I can't remember the Latin bit, but I... Pro re nata, there you go. Pro re nata medication, pre-discharge planning, the quality of note-taking, and there was cover for care coordinators. That was another one, particularly in that block of issues that we discussed. So we firmly believe it's a successful model, and we think it can be replicated elsewhere, and we'd be thrilled to share more with you to develop similar best practice. So thank you very much indeed.